This is a super high yield condition for step one. 28-year-old woman comes into the clinic complaining of vaginal odor for the past week. She has thin off-white discharge and a fishy smell after sex. She denies itching, burning, or dyspareunia. That's a painful sexual intercourse. And she is sexually active with multiple male partners, using condoms inconsistently. Pelvic exam shows normal appearing vulva and vagina. Speculum exam reveals a thin, homogeneous vaginal discharge coating the vaginal walls. pH is 5.5. Of potassium hydroxide produces a strong amine odor. Okay, a wet mount will show epithelial cells with your stippled borders. So what is it going to be? Take a look at these answers, and indeed it is metronidazole. So let's talk about it. So our explanation here is that we have this thin homogeneous discharge, our fishy odor after sex, and no itchy and no redness. And our pH is going to be super high here, and it's going to be a positive whiff test. I like to say if something smells fishy, then you need to get a clue, because also they're involved with clue cells. This is a really good chart here. So here, tricha, I like to think of trick as like a green frothy discharge. So it's like a trick, like a Nickelodeon, like the green stuff. Okay, that's going to be Trichomoniasis. And here is our bacterial vaginosis. That's going to be your Gardnerella vaginosis, and that's what we have, our fishy odor, and that is going to present with our clue cells. So remember the fishy, clue, and what do you treat it with? Clindamycin. You treat it with clindamycin and also metronidazole. And these are going to be orally taken, and or intravaginal, and it kills the inroads by disrupting the DNA, and you also avoid the alcohol. So other answers, let's talk about azithromycin. That's used for chlamydia. Ceftriaxone is used for gonorrhea, and fluconazole is used for candida, and that one would present with your itching and your thick discharge. So let's go up here to your yeast infection. This would be candida, and so you'd have the thick, white, curd-like discharge for your candida infection, pseudohyphae, and you treat it with fluconazole. And here's your penicillin G for your syphilis. That's pretty much it. So yeah, step one has you note that there's an overgrowth of anaerobic bacteria, clue cells, and to greater than the pH of 4.5. So a little bit more basic, causes a positive potassium hydroxide whiff test. Treat with metronidazole and clindamycin. That's pretty much all we need to know about this. Is bacterial vaginosis. Just wanted to make sure we covered this concept super thoroughly. There's another video about it, but it's always good to review because this probably will show up in your step exam. And what you need to know is that metronidazole is going to treat it, and also clindamycin. Take care. We'll see you in the next video.